What happens to your vagina as you age? This is quite an uncomfortable topic for a lot of people, understandably so, because these are not the kind of topics that we discuss on a daily basis. But it is important to know what happens to your body as you age so that you are not surprised, and also so that you are prepared by knowing some of the things that you can do to alleviate some of the not so pleasant changes. My name is Dr. Ipeleng, and I speak about women's health. So if this is something that interests you, go ahead and click on the subscribe button, comment, like, and share this video. In today's video, as you can see from the title, I'm going to be discussing some of the changes that happen to your vagina as you age. Just as your body ages, everything changes in your body, including your vagina. It doesn't look the same, nor does it function the same, especially when you approach menopause. It doesn't function the same as when you were younger. Some of these changes, although they are very much natural, they can affect your bathroom habits and also your sex life. Number one, dryness. This is one of the most distressing symptoms of menopause. Now, the question is, how does it happen? There's a hormone called estrogen that keeps the tissues of your vagina plump and moist. But as you grow older or as you approach menopause, the levels of this hormone drop, leaving the sensitive tissues of your vagina high and dry. This can lead to uncomfortable sex or even painful sex, but you can alleviate this by using lubricants and also having regular sex so that you keep up any moisture that you still have. Number two is you have less hair down there, and this is why. So your hair goes through a natural cycle where it grows for a period of time and then falls out. As you get older, this cycle becomes shorter. And also, as the levels of estrogen drops, the dominant hormone in a woman's body around menopause and after becomes testosterone, and testosterone fuels hair loss. So if the body loses more hair than it can replace, you will have less hair. So the same happens on your scalp, and it also happens down there. Number three is your labia become looser. This is because as you grow older, your skin tone changes, and it's because of the loss of elastin and collagen, which are the two proteins that keep your skin firm. Just as the skin on your face changes, the skin down there changes as well. If the sagging bothers you, there are some surgical procedures that can be done to firm up the labia. Number four, there is drooping. Your pelvic floor muscles act like a sling that supports the uterus, the bladder, the rectum, and the upper part of the vagina. Because of childbirth and menopause, these muscles can be weakened, and when they are weak, they will be drooping, or what we call prolapse medically, which means the organs cause a bulge inside the vagina, and this bulge can be so big that it goes all the way to the point where it's almost outside the vagina. There are surgical procedures to repair prolapse. Number five is going gray. You may expect the hair on your head to go gray, but you'll be surprised that the hair down there also turns gray. And this is because as you grow older, the pigment cells in each of your hair follicle may die, and there's less production of melanin, and this may cause the hair to change color, become gray, or even white. So whatever happens on your scalp happens down there too. Number six is the shrinkage. Around menopause, the levels of estrogen will drop, obviously, and this will lead to loss of elasticity and also thinning. Especially if you're not having sex, the vagina can become really shorter and narrower, and it will hurt when you have sex. Number seven is sex makes you sore. Because of the changes that I've already discussed, the thinning and the narrowing of the vagina, penetration becomes really painful. It can even lead to tearing and even bleeding. So, and the more you avoid sex, actually, the problem becomes worse. So it is important to use lubricant, or even speak to your doctor, to recommend some estrogen, some local estrogen that you can use down there, which will help with the thinning and the narrowing. I forgot the counting, but I think I'm at number eight. So if you have taken a mirror lately and looked at yourself down there, you will notice that the vulva just does not look the same. And what do I mean? Because there's less blood flow there, because obviously because of the loss of estrogen, it looks paler. And the inner lips may even look drier and thinner. And this is because of the same reason, loss of blood flow and loss of estrogen. The last one is the frequent UTIs. And how do you know that you have a UTI, which is a urinary tract infection? The frequent urge to urinate, the pain when urinating, or even the burning sensation when you are urinating could be a sign that you have a UTI. And why are these frequent? So the vagina is a home to a lot of bacteria. And because of loss of estrogen around menopause, the climate of the vagina, which is the pH of the vagina, changes. And when the pH of the vagina changes, this leads to the growth of a lot of bad bacteria, which can lead to UTIs or frequent UTIs when you are in your menopause era or after menopause. This is also caused by the thinning and the atrophy of the barrier down there, of the skin down there, which is actually supposed to protect you from infections. And because of the thinning and the atrophy, it's easy to disrupt that barrier and end up getting infections. You can ask your doctor to give you vaginal estrogen therapy, and this will help with the pH of your vagina as well as the atrophy, and this will reduce the UTIs. That's all for today. If you like this video, please subscribe to my channel, and I'll see you in the next one. Thank you. Bye.